Okay, the first thing you will do is do stationary circles, and usually if you're going to do it on yourself, you're going to cross your arms. Let's do one side at a time. So if this is my collarbone right here, I'm going to put my hand, the opposite hand, deep to my collarbone and rest this part of the hand or the fingers on there. And the movement is called a semicircle, and you go backwards toward the neck, and then you relax your pressure and the skin takes you back to the starting place. So you're going to go back toward the neck and release. Back toward the neck and release. Should be about a second with the push and a second with the release. So the full circle will take you 2 full seconds. Normally, when you're stimulating the lymph nodes, you want to do about 8 to 10. All right, let's say I did 10 on that side. I'm going to go to the other side. Again, here's my collarbone here. I'm going to put my hand deep to my collarbone. I'm going to let my fingers kind of contour to the shape of it. I'm going to go backwards toward the neck and release. Back toward the neck and release. The movement is more, the power of the movement is more in the rest of your arm, not in your fingers. So you're not digging with your fingers. You're kind of just stretching the skin in a half circle and then release. Half circle and release. And make sure you're doing it nice and slow, about 2 seconds per circle. If you really were talented, you could do both at the same time. Usually I get my thumbs out of the way. Now we'll do the cervical or neck lymph nodes. So we're going to put our hands on either side of our neck, and we're going to do our semicircles backwards, down, and release. Backwards, down, and release. And then most of my pressure is kind of on this part of the hand. I'm only holding on enough to, only putting enough pressure enough to hold on to the skin. So half circles and release. And again, it's about a second with the half circle and a second with the release, where the skin takes you back to your starting place. You could do, if you want to do one at a time, you could do it like this, or you could do it like this. You could also do one at a time on this side, like this, or like this. And you do about 10 circles. All right, the next part would be your armpit or axillary lymph nodes. So you're going to put your hand over your head or hand up. So you can put your other hand into the armpit, and you're going to do your half circle. So your hand's in the armpit, pressure, and release. I'm not sliding over the skin. I'm not digging with my fingers. I have kind of a hand that's kind of stiff a little bit, contoured to the shape of the armpit. I'm doing half circle and release. Kind of up and in toward the core, to the center of the body. Okay, 10 on that side, and then 10 on this side. If you have a hard time lifting your arm up, you can rest it on something. Just enough to get your hand in there to do your half circles. So after you've done your collarbones and your neck, you would do your armpit lymph nodes, and then you would do your groin lymph nodes. So you put your hand right in the groin and do a half circle up toward the center and release. You can use your other hand on top to help with the motion. Half circle and release. Half circle and release. Just like that, about 10 at each groin. Half circle and release. Okay, after you've done that, then you would go up from the groin to the armpit, kind of along the side front. Up from the armpit, and you can kind of use your other hand. It's a little awkward to do this. You can do it on yourself. It is easier when someone else does it on you, but it is doable to do on yourself. Going up the side. Once you've done at least 5 times where you went from groin to armpit, then you could start adding in some of the thigh. And you're stretching the skin up and releasing. Stretch up and release. You may want to do skin on skin if your hand tends to slide. It's not a whole lot of movement for me on my thighs. Usually you're doing the outside of the thigh first. Take it all the way up to the armpit here. You can also take it across kind of the pelvis area, the lower abdomen, toward the opposite side if this groin lymph node is not affected or this leg is not affected. If it is affected, you're going to do the same on this side as you do this side and not go across. So if this leg is the only one affected, I'm doing the outside of the thigh and going all the way up to the armpit. After I've done that a few times, I can go from the inside of the thigh across, push it to the outside of the thigh, from the inside, stretch and release, stretch and release. Take your time. Remember, it's 2 seconds. 1 second for the push, 1 second for the release. I have to remind myself to slow down as well. Okay, after you've done the inside to the outside and you've done up the outside, you can start on the knee as well. So you're just kind of stretching the tissue from the knee up. If you can reach down there, you can do your calf as well. You don't, even if you have swelling just on your feet, you don't want to just go straight to your feet because this area is also blocked, so you want to kind of release it so the fluid has somewhere to go. Another wonderful exercise is deep diaphragmatic breathing. So you're going to put your hand on your belly and one on your chest, and you want your belly hand to rise with a big breath. So go. See how my belly hand rises out or puffs out? You can always also resist your diaphragm by pushing in while it swells out. So I'm making it a little harder for that diaphragm to work. And that diaphragm is a muscle that's kind of shaped like this from the front to the back. And what it does is it lowers down when you use it, and it creates more space in the trunk area. And when you have more space in here, the lymphatic system likes to go from high pressure to low pressure. So you've created a bigger space, lower pressure, so it helps suck the fluid out of the arms and legs. So increasing your lymphatic flow. Starting and ending with the collarbone lymph nodes and the neck lymph nodes is a great idea, as well as doing the diaphragmatic breathing.